Hi there, it's me, Sharon. This is only my second video and it's still really awkward. I don't even know kind of where to look or what. I am posting this because I wanted to document my progression and the process that I am going through in preparing for and having the gastric bypass surgery. It's scheduled for me July 29th, 2015. Today's July 15th, so it's exactly 2 weeks pre-op for me. I had, well, first of all, I want to show you where I'm sitting. So I'm outside, sitting in my little oasis gazebo that my husband built for me. It's kind of neat. Love it. It's beautiful, and it's really, today has been a difficult day food wise. I had appointments all day. I had my last nutrition appointment that I'm going to have until I'm 2 weeks post-op, and then I also had my hospital pre-op appointment. I was there for hours. It was kind of ridiculous, but it's a process, and I'm embracing it. So I had all that, and then I came home and I was starving because I started the pre-op diet today, which consists of my pre-op diet that my surgeon recommends consists of I'm sorry, I just realized that I think I have the same shirt on that I had on in the last video. Anyway, that doesn't matter. So 2 shakes a day and a meal. So I was pretty hungry when I came home, and I am diabetic, so my blood sugar was low, and I'm struggling with that as well, as I'm insulin dependent diabetic. So I'm have to adjust my insulin as the food changes, and that's a whole nother stress in itself. So anyways, I came home and I went in my room and I tried to watch TV, and I was of course obsessing about food and thinking about how hungry I was, and I had a headache, and so then I kind of was like walking around, and it was hard to be in the house because of all the food. I have 2 kids and a husband, and they don't need to go on this diet with me. They're all healthy and stuff, but so I decided to just come outside, and since I've been out here, I've been feeling a little bit better, and it's easier. So I think that I might just get a sleeping bag and hunker down out here and sleep out here for the next 2 weeks. No, I'm kidding. I won't do that. But this is definitely gonna be what I'm gonna call my oasis. So I think it's peaceful and calming and relaxing, and I just love it. So enough about that. I want to say that everything that I talk about is my journey and my process and what I'm dealing with, and the recommendations from my surgeon may be very different than the recommendations of your surgeon. I did a lot of reading and research, and went on, I don't even know how many weight loss surgery websites for different facilities that perform this, and they're trying to get an idea of what the pre-op diet was going to look like, and what the post-op diet was, and they all are kind of pretty different. They can be pretty different from surgeon to surgeon, so you have to do what your surgeon recommends. Again, this is only what my surgeon recommends. So the diet started today, and it consists, I think I told you, of 2 shakes in the morning, one in the morning, one for lunch, and then your dinner, which is like 3 ounces of lean protein, a cup of vegetables. You can really have unlimited vegetables if you're starving, and a little bit of fruit. So the nutritionist today, she said that I could, because of the diabetes, have like small snacks in between to maintain my sugar, and they have to consist of protein and Like I could do some grapes with a cheese stick or a cottage cheese, and I did sugar snap peas with them, but stuff like that. So I think that what I want to talk about today more than anything is the emotional part of all this, because I've seen lots of videos talking about people's process and stuff, but either I'm just a big wimp and can't handle anything, which isn't the case, or people just really aren't talking about how emotional this is. This whole process for me has been emotional. Getting to this point to agree to have the surgery has been a big decision for me. I am type 2 diabetic, and I'm on insulin, and I've been diabetic for about 19 years. So I'm starting to see complications from the diabetes. And I'm fairly young, so the amount of medications I'm on and the complications, I'm too young to be having this. And the doctor said to me, literally, you need to do something or you're not going to be alive in 5 or 10 years. My liver is not happy right now, and neither is my pancreas. My insulin, I'm on a large amount of insulin, a really large amount, and it's not even really effective anymore with the foods and the diet I was eating. So with that said, there's a whole other side to this, that is the addiction. And I definitely have a significant food addiction, and it's debilitating to me at times. And I have been working on it. I've been seeing a therapist and trying to work through it. I have a long way to go, but that's a whole nother process to this that needs to be talked about. Like, I don't know how people go through this surgery and don't work on their food addictions and think that they'll be successful. I've been working on it for about 7 months now, pretty intensively, and today not being able to eat and knowing, like, when I was at the hospital waiting for the pre-op and I was starving and my blood sugar was a little bit low, normally I would have went to like the cafeteria and grabbed food, something very carbohydrate driven, like a bagel or a slice of pizza or french fries or something, not really appropriate for diabetes, but to get my blood sugar up. And the fact that I couldn't do that because this is such a strict diet that I have to be on for 2 weeks really created some anxiety in me, some significant anxiety. And then when I came home and I was hungry and I saw the food in the kitchen and knowing that what we have in the house really made me put me in a panic mode. And I actually said to my husband, I want to cancel the surgery. He, of course, said, why? I said, because I want to eat that bagel that's in the kitchen. And he said, okay, you can eat that bagel, but you're going to risk dying so you can have a bagel. Think about that. So I came outside and sat here and thought about it, and for a second thought, yes, it's worth it because I want that bagel. And then realized really it's not worth it, and it's my addiction talking that makes me want that bagel so bad, and I don't need it. I want it. And I was listening to a YouTube video of another bariatric patient who had said this once. She said, and it just stuck with me, you need to remember that you should, how did she say it? You have to remember that you should always be eating for what your body needs, not for what your mind wants, which is so true. So that mantra I try to say to myself when I get like this: eat for what your body needs, not what your mind wants. And so, I was saying that to myself and thinking about what my husband said and looking at my children, I thought, you know what, it's not worth it. So I was able to get past that for this moment. I think the next 2 weeks will be challenging for me, adjusting to these diet changes, not grabbing the food when I want it, and it's going to be very difficult. Okay, so on the other side of it, you have the emotional part that you've made a life-changing decision. I've made a decision to change my life, to be better than I've ever been, and be the best me that I could possibly be. I've been so limited for so long by my weight and by this food addiction that I'm done with that. I'm tired of being controlled by that and having that run my life, and it really limits what I'm capable of and what I could be doing, what my future is and stuff. So I'm excited as far as that goes. Like, I am really excited to take on that part of my life and to see where it goes. See where it goes from there. And so I think, for the most part, I'm ready, but it's scary. It's really, really scary. And anybody that tells you it's not either isn't ready. This is my own opinion. Isn't ready for this surgery because maybe they haven't done the work that they need to, or they're not in it for the right reasons. So again, I'm a very sensitive person. Maybe I just think things through deeper than other people. I'm not sure. But this is really pretty intense for me. So with that said, I think that things, I don't know. So I leave for vacation on Friday. We're going away for a week to the beach, so that will be a really good distraction. And then I'll come home and be home for 5 days. 5 days, and then go in for surgery. So I might put a video up the day before my surgery, depending on how I'm feeling. But the thing is I think that right now at this stage, the important thing is just getting through every hour by hour when you're in this pre-op diet. And it's not going to be easy, but other people have done it and they've been very successful, and I just am inspired by them and hope that I can do it too.